welcome back to Face It with Dr. G. I'm Dr. G, and I hope everyone's doing great. It's getting really beautiful here in the Boston area, and we all love this time of year. With all the traveling I've been doing, I'm getting, little hints of how beautiful other places are year-round. But I do love the Boston area, and this is the time to be here. It's so gorgeous. So if you guys haven't been here, let me know. I'll tell you where to go. So I wanted to talk a little bit about the double chin, and we have had a lot of, obviously over the years, a lot of patients that come in with this concern, but recently we've had it as well. And I thought it would be interesting to talk about how we approach the lower face and the double chin area specifically, because there are a lot of treatments and devices that may have a benefit initially, but over time they may not be the right option for you. And at the end of the day, it's best to see a provider that knows what they're doing. This can be an MD, a PA, and PRN that has experience with multiple different modalities. And this means different types of injectables, different types of maybe non-surgical suture suspension lifts or threads, and biostimulators and fat dissolving agents. And also, you also have to remember that non-injectable services are non-surgical injectable services are non-surgical injectable services, meaning they're not surgery. And the gold standard here for the submental region is either liposuction or surgery, a lower facelift. So what we do here and what I like to do with my patients is obviously be completely transparent with the options, looking at where they stand, what their goals are, and how we can get there. So typically what I do when I have a patient come in for this consultation is I discuss what their goals are, obviously. We oftentimes talk about how their double chin has evolved. Is this something that they have had throughout their life? Is this a genetic situation where they like to store fat underneath their chin? Have them look at their parents, see if they have the same type of clinical phenotype. And then talking to them also about their weight. So especially with the whole GLP-1 agonist boom and all of these different Ozempic and semaglutide and compounded weight loss medications, are they using one of those? And also, are they seeing fluctuations with their chin area when their weight fluctuates? If they are on one of these medications, obviously it's best to wait until they are at their goal weight or their ideal weight, because as you lose weight, your face will definitely change. So that's really, really important. And then the next thing is, talking to them about the progression, getting into the details of how and why they're frustrated with this area, how it's evolved, and again, what their goals are. So the first thing I like to do is to talk about the upper face in relation to the lower face, because when we just focus in on the lower face, we forget that a lot of the structure from the upper face is important when it comes to evaluating the lower face. So for example, when we lose volume superiorly, we see sagging and loss of volume and droopiness of the lower face. How do we prevent that? Well, it does help to rejuvenate the upper face, but we also do have to go to the lower face. And a lot of times I'll tell patients when they're in their 20s to 30s, start with a little bit of neurotoxin in the lower face. You can start very gradually at once a year, twice a year, to really relax those depressor muscles that pull down on the face. They create those jowls. So one of those muscles is called the platysma. It's obviously the thinnest muscle of the neck, inserts right over the mandible and pulls down. So you get these bands in your neck when you tense your neck that are pulling down. Everything we want in life is to go up, right? We want to smile, we want all the muscles to lift up, and we want those elevators to take over and those depressors to relax. So what we do is we do a little bit of Botox along the jawline. We'll use a Botox or Dysport or Xeomin or Jeuveau, or I'm using that as kind of a wastebasket term here, neurotoxin in the neck. We can also use that neurotoxin in the lower face chin area, so you can relax the depressors of the mouth, so the lateral aspect of the mouth, the DAOs, the inferior lip depressors, the depressor labii inferioris and inferioris. I'm having problems enunciating my words and pronouncing my words, and then the mentalis in the center. So understanding that all of those muscles are moving down I like to treat them together because patients can get that lifting effect all at once. However, if you knock out the full platysma, sometimes patients will feel that they can't hold their head on their neck and they feel a little bit bobble-headed. So do a little bit, sometimes I like to say 20 to 30 units instead of a full 48 units. It's what I typically use in Botox units, for example. And then they can come back and you can add to that. It just allows for perfecting of the dose versus wham, bam, slam dunk, and now they can't move their head. So that's one thing that I really like to do. The other thing that you can tell patients is this is preventative. So this is not going to get rid of their submental fat, but this is going to help lift everything around their lower face and their neck. It's going to help prevent that sagging. So then when we look centrally to those fat cells, you can think of things like Kybella, so deoxycholic acid that helps to dissolve, and it actually permanently dissolves the fat cells. I would say that this is a difficult product to use, and a lot of patients and providers just say, okay, no, you're just going to dissolve the fat, it's going to go away. But in reality, you need to make sure that you're actually dissolving fat and that the patient's symptoms are not due to lax skin. And patients will typically need 2 to 3 treatments with Kybella, and the results can be really, really great. But I've also seen patients that are resistant to this, that they don't see that beautiful result that you see on Instagram. And so it's nice to have other tools in your toolbox. So Kybella is one. The other thing that I like to use in the submental region is smooth threads. Smooth threads are PDO threads, so polydeoxanone, and they are dissolvable suture material. So they are like, if you go to the emergency room, you have a cut, you get sewed up, your body degrades these over time. So they're absorbable sutures, which during that process, you're also creating both hyaluronic acid and collagen. And so by doing that, you're gently tightening the area. And I tell patients, let's do 1 round, come back in 3 months and we can do it again. So you can do this every 3 months, and it's gentle tightening and collagen stimulation. Now, obviously, if you have a large fatty deposit in your submental region, doing smooth threads there with that picture is not going to be hugely beneficial. You want to make sure you're choosing the right patient and that they don't have as much of a fatty deposit. And if they do, either using Kybella or even cool sculpting, which again, I have a love-hate relationship with cool sculpting. I think that it's not ideal. Patients can have rebound, and they can also not have the result they want, and it's not as customizable of a treatment as something like Kybella, where you're injecting an agent to dissolve the fat. The other thing that you want to look at when you're addressing the submental region is the jawline. So if somebody has centrally placed fatty tissue, and you can actually see or palpate that jawline, creating almost a fake jawline that looks real helps to support and strengthen and tighten. And then if they have a jawline that you can actually see, just optimizing and fortifying that jawline can help to tighten underneath the chin. Another thing that you can do is evaluate the chin. So if they have a retroverted chin and very, very set back, so that you feel the patient doesn't have that bony support, it's probably affected by their dentition. There are probably a bunch of things going on here, but that mental strain that is created from lack of bony support, so the mentalis muscle will overcompensate and start to work harder. You'll see some cobblestoning, you'll see overactivity, you may see a little transverse crease on the chin. So there's a bunch of different things at play here. So if you fortify the chin at the same time as helping stabilize and fortify the jawline, you're stretching all the tissue out. If you can try to imagine that it's giving structure, and the underneath the chin area will have support and it will stretch those tissues out. So I love that approach. Again, the patient selection is key here. And if there is so much tissue and so much fatty tissue there underneath the chin that you really feel like you can't see a jawline, giving the chin any projection or volume isn't going to really stretch that tissue out. And there's complete lack of definition of the jawline and even neck area, then I think that's when you say, liposuction, which is the gold standard, or surgical intervention is going to be your best bet. At the end of the day, slow and steady wins the race here. You have to use measures that are both preventative and also measures that are treatment based. So getting your patient to a goal where you've done a bunch of treatments, now they're happy, well, that's where you start the maintenance. That's where you start the preventative treatments. So you say, okay, where do you want to get? They tell you, and then you get there. Okay, let's maintain. And how do we do that? That's with a neurotoxin to help prevent those muscles from contracting and pulling down on the face. That's where you can do gentle collagen stimulators in the neck. You can use tightening devices. You can use radiofrequency microneedling devices that help tighten and lift the skin. So there's a bunch of different things here. I hope that was helpful. So my kind of toolbox for the lower face of things I use in the office are neurotoxins, biostimulators, mostly Radiesse for the jawline. For the chin, I'll use a hyaluronic acid filler like an RHA 3 or 4. Define is great, Lift is great. And Kybella for the submental region for dissolving fat. Cool sculpting, which we don't offer here, and I'm not a huge fan of, but it's okay. And then smooth threads. So I would love to hear from you guys what you use from that toolbox, what you think, and how that has helped you in your practice. The other thing I didn't really mention was lifting threads, and you can use barbed lifting threads along the jawline to help pull that jawline back as well. But I find that I like using a biostimulator like Radiesse, calcium and phosphate based, that helps both simulate bone, stimulate collagen, and give that beautiful definition that's a little bit longer lasting in my opinion than a thread, but you can do threads as well. So I hope this was helpful. Let me know your thoughts, and I hope to see you guys next time.